This is our April caregiver meeting on Parkinson's disease. Parkinson's disease is untreatable, true or false? The answer is false. Parkinson's is untreatable. It is not curable. Women are more likely than men to suffer from Parkinson's. The answer to that is also false. Over 100 million people in North America alone have Parkinson's disease. It is not necessarily hereditary, and it can be environmentally induced. Parkinson's disease is difficult to diagnose in the early stages, and that is true. The problem with the early stages of Parkinson's disease and the diagnosis is that a lot of the symptoms mirror other types of cognitive issues, such as Alzheimer's with the dementia. So at the end of this class, you'll be able to describe the symptoms of Parkinson's disease, and you'll be able to list the ways caregivers can support a client living with Parkinson's disease. So Parkinson's disease is a gradual degenerative process of the brain cells. It's a reduction in the dopamine. The first signs are likely barely noticeable. Often the first sign that you're going to see would be a tremor in the hand, and that tremor is at rest. So when people are actually functioning and doing things, you're not going to notice the tremor. Eventually the symptoms become more severe, and as the disease progresses, depression, cognitive issues, and other mental or emotional problems will be found and are common. Motor symptoms of Parkinson's disease are the ones that you find most often in the beginning. The shakings or tremors that we talked about at rest. There's a slowness of movement. There's a stiffness or rigidity of the arms, legs, or trunk, and there's trouble with balance and falls. So the tremor at rest will start maybe in the right or the left hand, and eventually it will be on one side, and that will progress down the entire side from the hand and the upper extremity to the lower extremity. Eventually, the slowness of movement, the stiffness, which is the rigidity, the poor balance, all become part of the disease process as it progresses, and it happens because the progression spreads down the entire body. So the shaking of hands can be intermittent, and it also will worsen when a client is feeling anxious, or there's excitement, or there's stress. So as a caregiver, if we notice that the client begins to shake more and they're anxious more, what we want to do is find a way to calm them down and redirect them and distract them from what is causing that stress or anxiety. The slowness of movement, it's with all of the clients, and it's a result of feelings of incoordination. There's weakness, there's tiredness. So it's really our job as a caregiver to just allow the clients the time that they need to engage in that movement, to stand, to walk. The rigidity in the arms and the legs impairs their ability to walk. And so a lot of times you'll see that shuffling walk with Parkinson's disease, and they may start off really fast and their legs start to move really quickly, but they're not going anywhere yet. And then they kind of walk quickly forward. And then they stop and they freeze again. So again, all of the responsibilities that we have as caregivers is to keep them calm, to distract them, to support them, and to try and keep their frustration at a minimal if we can. Poor balance, the postural instability is often part of Parkinson's. It's part of the autonomic reflexes that are triggered in the brain. So falls are a big risk for these clients. One of the ways to diagnose Parkinson's is to push forward on the shoulders, and the clients will fall back. Normally when we are pushed back, we have a way to prevent ourselves from falling back. We resist that. Parkinson's patients or clients are not able to resist that. So there are other symptoms of Parkinson's disease. It's the physical somatic symptoms, the postural things are things that we see often, but the disease itself affects the autonomic nervous system. And the autonomic nervous system is the part of our body that has two things. And one is the fight flight response that we have. And so when we get scared or when we get anxious, it's the sympathetic response to that stress in our bodies. The blood goes to our legs and our hands, and it goes to our heartbeat, which starts to race, and we're in a position where we can run or fight. The parasympathetic part of the autonomic nervous system is that part of our body that helps to calm us down. But it also affects digestion, urination, sexual drive. So there are a lot of components of the nervous system that are affected by this disease. Um, there are definitely cognitive problems. Dementia is a component of it. And so that's another reason why it's often hard to diagnose Parkinson's from other um, dementias and other neurological diseases with the elderly. The thing that stands out a lot in Parkinson's is psychosis and hallucinations. So your clients will have hallucinations. Usually they're visual. They will see things in the room. But they also they could hear things, and it could also be tactile. The psychosis tends to be paranoid psychosis. So a lot of these Parkinson's patients, our clients, will become paranoid. They may think that their wife is an intruder. We have a client at home instead who is terrified of someone breaking into the house at night. So the caregivers have to make sure that they close all the windows and lock them and draw the drapes for him. And you can't explain to him that that's not real. To these clients, these hallucinations and these psychoses are real. We had another client who was talking to something on the floor, and the caregiver said to her, "What are you speaking to? Who are you speaking to?" And she said, "That little dog down there." Now, you couldn't explain to the client that the dog wasn't there. She really saw that dog. So the caregiver said, "Okay, well, let's move on. Let's get out of bed and move, and the dog will go away, and we can get on with our day." So the most important thing with these clients is not to try and fight them on these delusions and these hallucinations, but try and find a way to calm them down and again, always redirect them. In addition to the psychosis and the hallucinations, there are mood disorders. So there's depression. And usually the depression will include sadness or the loss of an ability to express themselves in pleasure. And because of that, they have a decreased interest in activities. And so they also become very anxious. They have panic attacks. There's excessive worry or fear, all part of this process, this cognitive process. And then apathy. They get apathetic because their speech is diminished, their movement is diminished, they're upset, their quality of life is changing. And so they feel like, well, why should I bother? And again, as caregivers, it's our responsibility to support them and to encourage them and to not negate their feelings, but to try and work with them so that they can get past them. Additionally, because of the autonomic issues, there's sleep disorders with Parkinson's disease. They may have daytime sleepiness. And the concern in this situation is if they are still driving, you have a client who becomes very, very sleepy during the day and may not be as with it as far as driving goes, and they may not see the cues that they need to see and could actually get into an accident. Because of their daytime sleepiness too, there's a feeling of fatigue. And part of that is associated with the issues that they have at night. So they have problems sleeping at night. They have disruptions in their sleeping patterns. And they also have something called a restless leg, which will cause pain, and the legs start to move and it causes pain and it wakes them up. So they end up waking up a lot at night. So that also contributes to their daytime sleepiness, and it also contributes to the fatigue that they're feeling. Now, going back to the autonomic nervous system, as I said, it affects the gut. So there's issues with constipation. There might be issues with excessive sweating, or they might have dry skin. There might be urinary incontinence issues. Usually there are. They have a loss of the sense of smell, so that decreases their interest in food. And most of us have experienced, a lot of us have experienced that with COVID now. When you can't smell and taste things, it's no fun to eat or drink. There's also, as we talked about, the sleep disorders. They also have a lot of pain. There's tightness, there's burning, there's possibly tingling in their fingers. Their handwriting, their fingers cramp and their handwriting gets smaller. And this is also one of the beginning ways that they can diagnose that someone is developing Parkinson's. If they have a normal handwriting and then all of a sudden it's changing and it's becoming cramped. There's a reduced arm swing, and there's the slight foot drag that they have with shuffling. We had a client with Parkinson's once, and PT worked with them. He had a foot drag. He tripped over his foot, and he fell. So PT got him a brace for his foot, and they worked on him, and they were able to work with him enough so that he could take that brace off and walk appropriately with his walker afterwards. We've talked about freezing already. They have a loss of facial expressions because they don't have the muscle control and they have that rigidity in their face. So you may be speaking to them and they may not actually be expressive, and their facial features may not be expressive, and you may think that they're not really there, but they are. They just can't make those normal facial expressions that we make. They also, their speech becomes muffled again, and it's all because of the muscular control and the freezing of the body. We talked about the tendency to fall backwards, and then just there's a decrease in autonomic reflexes. The pain for them is very real. We all experience pain differently. Pain is very subjective. So if they're telling you in pain that they're in pain, then you accept that they are and try to reposition them or try to distract them. Again, a lot of what goes on with these clients is a fear and anxiety that starts to compound as it gets worse. So a lot of what we can do as caregivers is to distract them from this discomfort that they're feeling and assist them in moving on. So other common problems with Parkinson's disease is the blurred vision or the difficulty focusing. They also have double vision. And again, just like the perspiring, there can be excessive tearing or there can be dry eyes. So either way, you want to treat whatever symptom they are having. There's a difficulty in differentiating between light colors and the slight color differences. There's a spatial and depth perception issue. As we talked about the visual hallucinations, there are involuntary spasms of the eyelids, there's a weakness or fatigue of the eyes, and there is a sensitivity to light. So here in Cleveland, most of our days are kind of cloudy, but you may think that it's fine and you're comfortable, but they may be very uncomfortable with those lights. So they may want you to dim the lights, but then again, that also becomes a conflict with their issues with falling and their depth perception, so they can't see the step as well. And if it's dim in there, they are more of a falls risk. So there are treatments for Parkinson's, as we said. There's no cure. There's medication that they can take. Oftentimes, the medication that they take will induce those the delusions that they have. So as a caregiver, you're monitoring them and you're noticing any change in their behavior. If you know that a medication has been switched and now all of a sudden they're having paranoid delusions, you want to make sure that your client care manager knows. You want to make sure that your family knows so they can address it with the client's physician. The surgery is more of a laser surgery on the brain. They can zap certain areas of the brain to help with some of the symptoms. Physical therapy is an integral part of Parkinson's disease. It's very effective in helping them to be able to ambulate more effectively. A lot of our clients will have physical therapy, and so it's important as caregivers to make sure that we are having them practice their exercises during the day while they're with them. Well-balanced meals are important for everyone. The problem is you want to pick your battles. Dealing with people who are in their 70s or 80s and have had pretty much a standard diet for a long time. So I think it's probably more important for you to make sure they're getting their exercise in, try to encourage them to eat well. The other thing about Parkinson's is that they feel full very quickly. So you want to give them smaller meals, maybe more frequently. Another thing, if their mouth is dry, if that's one of their symptoms, you might want to give them a sip of something wet or like a spoonful of yogurt first before you actually feed them their meal to moisten the mouth. Of course, the other option is if there's a lot of drooling, so then you want to make sure that you have napkins and stuff around to help keep them clean. So we want to build trust, we want to take the lead, and we want to share with our heart. And this is stuff that you always do as caregivers every single day with every client that you have. So the role of a caregiver is to maintain regular communication with the franchise office, to offer tips to encourage the client to maintain a fulfilling lifestyle. So always, if you see any change in behavior, if you see anything that's going on, you want to call your client care manager, remembering always that this is a progressive disease. It's going to start and you're going to see a progression of the symptoms. Bathing tips. You want to boost the client's self-esteem. You want to challenge the client to do as much as they can for themselves and allow them to do as much as they can for themselves. So looking at this picture, I want you to tell me what's wrong with this picture. And yes, the answer is he's using a razor to shave the client. At home instead, we do not use blade razors, we use electric razors. But you want to maybe take the client into the bathroom, put them on a chair in front of the sink, and let them brush their own teeth. Let them wash their face. Let them use the razor if they can, if the trembling and the tremors are not too bad. You want to reduce the risk of falling. You want to encourage the client to sit down to do tasks, as we said already, and you do not want to rush them. Allow them plenty of time. Because they can't start as quickly, because they can't get their body moving, it's very frustrating for them. So you want to make sure that you give them plenty of time to accomplish whatever task it is that you're encouraging them to do. Toileting is always it's a tricky subject for anyone. The client has a significant loss of dignity and self-respect when we take them into the bathroom, but it's something that we have to do. As always, you allow them to do as much as they can, and you provide for privacy. So maybe you'll get them into the bathroom and get them situated, but you'll wait outside of the door for a while until they call you in. And in most cases, this is going to work for most of your clients, but as the disease process progresses, and as you may be more worried about falls, you may have to be spending more time in the bathroom with them. And so it's a matter of talking them through this and having them know that you understand how embarrassing this is and how hard it is for them, and that you will do your utmost to give them as much dignity and respect as possible. Dressing tips. So again, you always want to help them, but you want to keep them, encourage them to be as independent as possible. So remember, the dexterity becomes a problem. They can't use their fingers the way they used to, so they will need assistance ultimately with buttons and zippers and things like that. They may need more assistance with dressing their lower extremities. You may want to put their feet up on a stool so that they can use the stool to reach their feet more easily, to put their own socks on as long as they can. It's important to get them up and get them dressed. As COVID has been around for this year, we know that it's easy to stay in your pajamas on the sofa all day. But it's important to have some semblance of a routine for them. So you would encourage them to get washed up and get dressed, even if they're just going to sit on the sofa that day. Eating can be challenging. As we said, one thing, they get full very quickly, but also there's a risk of choking. So you want to make sure that the food that you're offering them is in small bite-sized portions so that they don't have problems chewing it. And remember, with the dry mouth or the excessive saliva, you want to adjust for those symptoms. But you also want to make sure maybe that they're not talking while they're eating, because when you talk and you have food in your mouth, it's easier to aspirate. So you set them up, you don't encourage talking with them while they're eating. And because the elderly clients, when they start to aspirate, they end up in the hospital often with pneumonia because they can't clear the aspirate out of their lungs, and so they end up with a bacterial pneumonia. And once they're in the hospital, there's all kinds of risk for continued issues in the hospital, and oftentimes one hospitalization will lead to another. Mobility tips. So you want to make sure that the pathways are well lit and that they're free of clutter. And this is in any situation. We have an elderly client who's unstable on their feet. We want to get rid of throw rugs. We want to make sure that there's space between the furniture for them to walk. We want to encourage the clients to use handrails, to use their walkers so that they have something to hold on to while they're walking. We want to encourage good body mechanics when they stand up and when they sit down. You want to make sure that when you're helping them out of a chair, their feet are hip width apart and their heels are solidly on the ground. You want to stand with your legs outside of there so you're supporting their knees so that when they stand up, their knees don't give out. And if you recognize in their home that their disease process is progressing and you think that there's anything that could be improved upon in the home to keep them safe, then call your client care manager and they can speak to the family about maybe putting handrails in or bars in the bathroom if they're not there. And we want to remember getting into and out of bed and getting up and out of the chair or up and out of a wheelchair. You want to make sure, as I said, that their feet are hip width apart, their bottoms are right at the edge of the chair. They're using the handles on the chair to push themselves up. This is not a good example of her holding onto the walker to stand up because it's not as stable as a chair would be. Falls are really, really, they're a big problem for the client. And again, it's just like the aspiration pneumonia. If a client falls and they end up in the hospital with a fracture, they're going to end up in rehab. They may never get back to where they were before, and always with these elderly clients, with all of our elderly clients, one fall can lead to another fall, another hospitalization, and it's really not good for them. So to prevent falls, you want to, as the disease progresses, you want to make sure that the client doesn't lose confidence in their ability to walk, because the frequent falls may lead to, as we said, repeated fractures or soft tissue injury. And remember, the freezing, the involuntary ability to move is a big issue with them. So if a client's moving and they begin to freeze, you want to encourage that client to relax, maybe count out loud, and then the client can start moving again. One of our caregivers, when we were giving this lecture live, was talking about how she had classical music playing and it helped to relax the client, and then they could move on again. So a lot of it is redirecting and calming the client down, because these physiological changes are things that they can't control, and when they start to get upset, everything becomes worse. There are a lot of assistive devices out there. The little cup is nice because it's cut out for the nose so that they don't need to lean their neck back when they're drinking. If they're in the house, we would encourage you to use them. If they're not in the house and you think they would be helpful to the client, you can always call the CCM and she or he can help you talk to the family and maybe find these devices so that they can be purchased and used for the clients. So remember, it's a chronic disease and it's like other chronic conditions. It's important to understand the client's abilities and to work to meet their needs, to encourage as much independence as you possibly can, and if you have any questions or if they need any information, you can always call the franchise to get further information on the disease. You always want to recognize symptoms and recognize any progression of the symptoms or any additional care needs. You guys are the people that are with them most of the time, and you're really able to see the changes. You want to report any changes to the franchise. If you have a relationship with the family, you want to report them to the family. You want to make sure that you're recording these changes in the journal so any caregiver that follows you is able to see what's been happening. Like, let's say the client had a really bad night and there was a lot of a restless leg and they were up a lot in pain. The caregiver coming on in the day needs to know that so that they can adjust the client's schedule to compensate for the lack of sleep they got that night. Always, dignity and respect is important for all of our clients, not just our Parkinson's clients. These clients get very frustrated and they get very depressed, so it's so important for us to be patient, to be supportive, to be kind, and to let them know that they're okay and they're not in this alone. So at the end of this class now, you should be able to describe the symptoms of Parkinson's disease, and you should be able to list the way that you as a caregiver can support these clients in their process.